Yeah, like the rest of the Sinn Féin speakers, I want to thank the Social Democrats for bringing forward this very important motion. Diagnosis of cancer is absolutely devastating for an individual and for their family. It is a shock to the system. It is completely unacceptable that in the midst of this upset, fear, anger and sickness, that the HSE are sending debt collectors letters to people. The HSE has spent over €4 million on these debt collecting agencies for cancer patients since 2013. This is a shameful indictment of the treatment of cancer patients in the state. We often look to America and their healthcare system. Now, obviously, our system is much better in caring than those, but for these cancer patients, it's not. For these cancer patients, receiving debt collectors agencies while in the midst of chemotherapy for cancer is completely unacceptable. The HSE give people 37 days before the debt collectors contact them. That's less than 6 weeks after admission to hospital, and these debt collecting agencies are knocking on their doors. And for some people, €800 is not small money. There are so many hidden costs to when a person gets a cancer diagnosis. Time off work, for them, for their families, transports, medicine, for some people, wigs, because of the effects of chemotherapy. For some people, a bill of €800 arriving to their door is not affordable, but it also is like a dagger on top of everything when you're struggling, when you're at your most vulnerable, that you have people looking a debt collection agency at your door. And what it does is it completely undermines the individual that, on top of this terrible illness, that the cost on them and their family. So there's the human side of this. It's wrong and it must stop. I just want to take the opportunity to briefly raise the delay in care of cancer treatments during COVID-19. A neighbour of mine, a friend of mine, his wife contacted me last week to say that her husband was very sick last August, September, had to wait 2 months for a scan. That scan revealed a tumour in his brain, which required emergency operation. Up to the weekend, that operation, they were waiting for contact for it to be done. Now, it's a tumour on the brain. A delay because of COVID-19 for access to scanning, a delay because of COVID-19 for access to emergency surgery. And the opposition have been highlighting since the start of the pandemic the importance that that cancer patients and other seriously ill people couldn't fall through the cracks because of COVID. But obviously this man, Tom, and my thoughts and prayers go to him and his family for what they're going through at the moment. And coupled with this then, what you have is, I suppose, the weight of the family, and then to receive a bill and have debt collectors chasing you down. And the other side of this then is car parking charges. Just the point I want to make is, having to go to the hospital then and to pay car parking charges for when you're going in for chemotherapy, surgery or clinics, to be honest, Minister, that has to change, it has to stop.
Thank you, Deputy Mayor.